hi Jesse and Rebecca. You both have the same question, and it's a very, very common question, and it's a really good one. The answer is very little. It's pretty amazing actually. I remember when I was first learning how to do this many years ago, and I had had the typical experience of most dentists. We remove a few wisdom teeth, and patient is sick for a week or two, and remove just a few normal natural teeth, and they're sore for several days. And so when I was first learning to do this, and I went in to observe this surgery with the doctor who taught me, I was stunned. He removed, I don't know, maybe 15 or 20 teeth for that patient, put in 4 implants on the top and 4 on the bottom, and I'm going, this is going to hurt. And of course I voiced that concern to the doctor, and he had the patient come back to see him the next day because he was teaching me, and he wanted me to see what it was like. The patient came back, and I had an opportunity to visit with them and take a look and see how they looked. They looked great. Their teeth were beautiful. They weren't swollen. They weren't bruised. I asked them how they were feeling. They said they had had a meal that evening when they went home. They said they had had breakfast that morning, and they said they had taken a couple of ibuprofen that day. It was about 1 in the afternoon when I saw that patient, and I saw other patients the same way. So I was just stunned. I couldn't imagine how that was being done. One was that the doctor was an exceptionally good surgeon. He knew what he was doing. He had done it many, many, many times. The other was that he understood very clearly how to use medications to help patients with pain. Most of us are accustomed to being treated for pain. We have pain, we're given something to take care of it and make us feel better. But that's not the ideal way to treat it. The ideal way to treat pain is to prevent it from happening to begin with. And with proper medications, that's easy to do. So the typical patient who has this work done, it's common that they're dental phobics. People that lose their teeth have usually had bad experiences in the past, and they don't go to the dentist often, and it's one of the reasons they're losing their teeth. So seeing people who are concerned about the discomfort is not uncommon at all. Initially, when you come in, you'll be given an IV to sedate you, and patients, you don't sleep through it, but you have very little awareness of what's going on, so it's comfortable for you. And the literally thousands of cases I've done, I've never had a patient when I was through with the procedure that said, oh, that was really difficult or that really hurt. It's just not something that happens. Afterwards, the typical patient will take about 2 to 4 ibuprofens the day after the surgery and the day after that, generally for 2 or 3 days. They go back to work the next day or get back on a plane, fly home, whatever they need to do. People are comfortable. So I know that it's difficult for you to believe me. I really do. But that's just what we hear over and over and over again. So as best I can say this to you, don't be concerned about the pain. You'll be fine.